We're going to welcome Dr. James Thorpe, who is an obstetrics and maternal-fetal medicine specialist. TJ, you want to bring Dr. Thorpe in? Dr. Thorpe is a warrior. He has been the most outspoken obstetrician I know. Hey, James. Hey, Jim. How are you?
It's such an honor to be with you, Dr. Bowden. Thanks for having me on.
Likewise. Sorry we had trouble getting you on. I understand that you narrowly escaped the American Board of Obstetrics coming after you, and you sent them a strongly worded letter that actually worked. Can you tell us what happened?
Yeah, it was a very interesting phenomena. Mary, what happened was that it was you, you and I and my wife Maggie have worked, and you're aware of our work, and so that we knew that the American College of Obstetricians and Gynecologists and the American Board of Obstetrics and Gynecology, as well as my third governing body, the Society for Maternal-Fetal Medicine, we knew they were all captured. And the reason we knew was that literally, Mary, within the span of a human pregnancy from December 2020 to September 27th, 2021, they had completely reversed their position on pushing the vaccines in pregnancy. They went completely polar opposite. So we knew there was a money exchange. And as you know, my wife and attorney, Maggie Thorpe, had broken that with a FOIA request. So what happened was that on September 27th, 2021, just like your board, my board, American Board of Obstetrics and Gynecology, ABOG, sent out, they had the audacity, Mary, to send out a letter to 62,000 OBGYN doctors and all the subspecialists, including me, not just in the United States of America, but in all six provinces of Canada and in a few countries in South America, stating very clearly, you will not repeat any misinformation, or we will destroy you, literally take away all of your state medical licenses and take away all of your board certifications. So they colluded with the American College of Obstetricians and Gynecologists. They colluded with the Society for Maternal-Fetal Medicine. They colluded with the American Board of Medical Specialties by name, and they colluded with the Federation of State Medical Boards. So those five entities, and when they sent that letter out, I'm sure you and I had the same reaction. I'm sure, got a similar letter like all of the other specialties did. And it was a letter of unbelief. I was a board examiner for the American Board of Obstetrics and Gynecology in Dallas. The center, the national center, is in Dallas, Texas, not too far from your home. And I was an examiner at the before the turn of the century, at the turn of the century, and so these were my contemporaries. And so I put a call into then executive director, Dr. George Wendell, who refused to talk to me on the phone. We had an email exchange, and literally he said, "You will do this, or we will remove your licenses." And I said, "We'll see about that." And so I sent around some, he didn't appreciate this very much, but literally this was communism. So I stole their logo as well as the other two organizations, and I put a red hammer and sickle over it. and I dispersed it on my social medias. That didn't go over very well, but I enjoyed it. And by within 3 months, I had written an an open letter to all the officers of the American Board of Obstetrics and Gynecology. Now, it was about a 15 page, it was really a 98-page letter, Mary, but the body of the letter was about 15 pages. All of the other pages were 1,019 peer reviewed medical journal publications documenting death and complication from the COVID-19 vaccine in just 12 months. So I had read all of those, and I had put them in the context of references in the bottom of that letter. I also did the first VAERS, Vaccine Adverse Event Registry System analysis of the obstetrical outcome in just the first 10 months. And Dr. Bowden, it was a bloody disaster. It was, no pun intended, it was awful. And I published that in an open letter format. It went viral. And it was, I had a little bit of assistance with my wife, an attorney, Maggie, in putting together that letter. Not a word, dead silence since then. They knew that I was right, and they knew they were wrong. They knew I had the goods on them. They didn't want to get in a lawsuit with me because there would be the discovery process, and they would just get in more trouble. So they just let me be. I'm still practicing, and I'm still board certified.
Well, I have asked, if you are watching this right now and you are on X, do me a favor, and in the comments, please tag them. I left their handle in the comments on X. Please tag them. Let them know that we're talking about this. Are you aware of any other obstetricians that they came after, or were you sort of the one and done, and once you shut them up, they went away?
I think that once they read that letter and they realized that it circled the globe, and they realized what they had done to 62,000 OBGYN doctors, I'm not aware. Nobody else has stepped forward like I have. Now, my dear friends in Florida, Dr. Kimberly Biss is a general OBGYN doc. She's amazing. She's come in along my side, and also Dr. Dan McDyer in Jacksonville in Florida have come along my side. So to really, it's just us, because everybody else is severely intimidated. You know how anxiety provoking it is to get a letter from the board like that. Nobody knows better than Dr. Bowden. And you've stood up like an amazing hero, just an incredibly courageous warrior. And by the way, you and others, with your courage, your boldness, your honesty, your integrity, you and Peter McCullough, Pierre Corey, I could list off more. There's so many of you. You really motivated me to stand for the truth with you all.
Well, what's interesting is we all came together from different parts of the country without knowing each other. We all came to the same conclusions just based on mostly our clinical experience, which, I'm sure you have lots of stories to share. What's one that really stands out in your mind? I know you recently had a patient with Guillain-Barré following the flu shot, and I want to get to that. But first, give us an example during the pandemic of a patient you saw where they got these shots and tragedy occurred.
Well, there's so many of them, and I outline that in my book. You probably see behind me, and the name of that book is Sacrifice. how the deadliest vaccine in history targeted the most vulnerable. And so I would say to chapter 7 of that book, and by the way, every dime of proceed from that book to me goes into a 501c3 at the wellness company called the Wellness Initiative Fund, and they're matching all of Maggie's and my donations, and it's only for the vaccine injured. And we've already made 3 grants. But chapter 7, wonderful. This is a true story, Dr. Bowden. If this doesn't send shockwaves up and down your listener's spine, nothing will. This is a true story, absolute 100% true story. The names were changed to remain anonymity, but this is a long-term friend of mine, and their son and daughter-in-law, completely normal pregnancy before the shots, 2019, beautiful baby. Got the shots. 8 consecutive dead babies. You say, Dr. Thorpe, how that doesn't make any sense. How can you get pregnant 8 times? Well, 2 of them were sets of twins. Some of them were early miscarriages. Several of them were fetal deaths. And the last and 8th, Mary, the name of this chapter is called 8 Candles. The last one was a week before her scheduled cesarean section. And she had a massive abruption, a massive life-threatening abruption, which means for your audience, the placenta completely separated, rushed her to the hospital, emergency cesarean section, dead baby, and multiple units of blood, and we almost lost her. This has been my life for the last 4 years, 5 years.
Well, that's just awful. And so can you clarify what the current recommendation is from our government and from the American College of Obstetrics? And it seems a little muddy to me. Are pregnant women high risk? Are they under that umbrella of high risk? What is the official recommendation at this point?
Well, it's not surprisingly, it is confusing to you and to me and to everybody else. In May, I was asked to testify again in the Congress, and I was with a team of experts, with Senator Ron Johnson, and they asked me to address the issues of pregnancy, which I did. A week later, I think that was around Memorial Day. The day after Memorial Day, maybe, then Secretary Kennedy, I believe the president, and Jay Bhattacharya, and also Marty McCreary stood up and said, we are no longer recommending pregnant women be vaccinated, period. Well, apparently the monstrosity of unnecessary, way too many employees of the HHS, CDC, FDA, they didn't agree with him, so they really knifed him in the back. They never actuated those recommendations. And now, allegedly, they've come back and said, oh, well, women are high risk, so they need to get the vaccine. But those 3 governing bodies that I spoke about, American Board of OBGYN, American College of Obstetricians and Gynecologists, Society for Maternal-Fetal Medicine, they're pushing them. They're criticizing Secretary Kennedy and the HHS, and they're saying, don't listen to them, listen to us. Well, they're purchased. They're bought. And it couldn't be more corrupt. And Dr. Bowden, you're you're too young to remember the disasters of thalidomide and diethylstilbestrol, but I lived through the consequences of those. We knew better. The golden rule of pregnancy should never, ever be broken in pregnancy, ever. We learned our lesson, but yet they continue to do this, and they ignore the 10 studies of vaccinated versus non-vaccinated that you're well aware of that have shown a dramatic detriment to those children vaccinated. And that brings me to one of those studies. And please allow me to indulge myself in this comparison, because nothing could be a greater contrast to Dr. Mary Talley Bowden and Dr. Marcus Zervos. And I know you know that name, but you compare and contrast these two individuals. They couldn't be more desperate, separated, a wider chasm on the spectrum of evil and good. Here you have Dr. Bowden, and I'm speaking to your audience, who has put everything on the line, everything, her life, her reputation, her family, her children, everything. She does it all for her commitment to truth, for her commitment to her patients. She's been through hell and back. And then you have Dr. Marcus Zervos. And I don't call too many people out. I don't pick on too many people except those people that are killing my pregnant women, preborns, and newborns. I do take certain exception. So let's contrast Dr. Mary Talley Bowden with Dr. Marcus Zervos, who is the senior author on the Henry Ford Hospital system. Now, what happened? Short story, I'll try to make it as short as I can, but Del Bigtree of ICANN Network down there in Austin knew that Henry Ford Health System was the perfect health system to do the non-vax versus vax and look at the outcome of the children. And so he flew up and he approached Dr. Zervos, who, by the way, was the hero. He was involved and diagnosed the Flint water crisis, which many of your viewers are probably familiar with. So Del Bigtree said, Dr. Zervos, will you do this study? And will you commit to publishing the results no matter what the results are? Dr. Zervos said, yeah, fund me, we'll do this, whatever, we'll do it. We'll do the study. It'll be meticulously done. Well, he did the study, but he realized what he did. He's such a evil person and a spineless, gutless wonder that he knew that he had an ace up his sleeve, that he would cook the books. So he would cook the books and fraudulently make the study look like there was a benefit to the vaccines. So he had planned that, in my opinion, that's my view. So in fact, when it came down to reckoning, he did cook the books, but the adverse multiple other variables and chronic diseases and deaths and neurological injury, cardiac injury, he covered up the autism he did a pretty good job with that. But there were so many other danger signals that were so strong and so robust that he couldn't change them. So he refused to publish it, Dr. Bowden. He refused to publish it. So Del Bigtree flew up to Detroit. By the way, my alma mater, Wayne State University School of Medicine, Henry Ford Hospital System, well known to me, and met with Zervos. And he had a hidden mic and a hidden camera because he didn't trust him. Now, that would have been illegal in Florida, but wasn't illegal in Michigan. And he asked Zervos, "You promised me you'd publish this." He goes, "I just the outcomes are too different. There's too many damages in the vaccinated children. I can't publish this, or I'll be like Peter McCullough." Dr. Peter McCullough, by the way, was also employed by that system, Henry Ford Hospital system, and for at least some time, and they probably knew each other. He actually called McCullough out by name. He said, "I don't want to be another Peter McCullough and fall in disfavor and lose my paycheck and be fired. I'm just not going to do that." So here you have a pathetic, really pathetic disgrace to the human race who doesn't have the emotional, the moral, ethical integrity to put his reputation on the line and lose a paycheck. And he injures and kills countless number of global children. Because as goes the United States of America, so goes the rest of the world. How can you, to see this stark reality of Dr. Mary Talley Bowden versus a despicable, pathetic, gutless, spineless wonder jellyfish, Marcus Zervos, I hate to even call him doctor. This says it all. I rest my case on the contrast.
Well, yeah, if anybody is curious, that movie is called An Inconvenient Study, and it really rattled me. And it really confirmed, what we all learned during the pandemic is there's cover-up involved, and these vaccines that we were all told were safe and effective have never been properly tested the way we thought they were. So that movie is very eye-opening, and it's just further confirmation that the whole vaccine industry is just built on lies and not truth and transparency. Well, unfortunately, we have run out of time, Dr. Thorpe, but I really appreciate you coming on, and we'll have you on soon because we really only scratched the surface. But I will leave a link to your book in the comments. It's called Sacrificed. And remember that if you bought, wait, is that right? Sacrificed?
That's right. Sacrifice.
Yeah. If you buy it, the money goes to help the vaccine injured, which is huge. Because the vaccine injured have been completely abandoned by our government. Only 0.2% applied for benefits, received them, and at this point it's too late unless you only have a year after the injury to file for a claim. So please buy the book, and that money goes towards helping the injured. So thank you so much, Dr. Thorpe, and we'll have you again soon to dive in deeper on all that data with the pregnant women that you've been seeing and reporting.
It's been an honor.
And we're going to take... Well, thank you. Good to see you.